Hello, everyone. Let's see. There we go. Can everyone see this? Okay, so my name is Gina Riggan. This is assignment 5, Herzing Talks for Herzing University, course BH 200, Professor Isaiah Gonzalez, August the 10th, 2025. So the topic I chose is equity in mental health among teens and young adults. So the kids that you see in the pictures are my kids. The one with me on the left, that's my oldest daughter. That's Sarah. And then the furthest one on the right is Sarah and her brother Justin. He's my second child, my middle child. And then my baby is the one in the middle with the graduation cap and gown on with honors. And then the baby is my one and only grandbaby. So that's Sarah, that's Justin, that's Abby, and the baby is Jupiter. So these are my reasons for being so compassionate about the mental health realm in children and young adults. My first daughter, when she was 16, she started going through a mental health crisis. Um, we didn't know what it was at the time, but of course, we took her to get help. They diagnosed her with obsessive compulsive disorder, and there are different types. So she had one category in particular. And they put her on medication, and they told us, we can put her on this medicine, but be sure to keep an eye on her because sometimes it can have reverse effects and she can become suicidal. So, needless to say, um, the medicine had the opposite effect on her and she became suicidal. So, the day of her 17th birthday, December 12th, 2013, we were faced with having to take her to a hospital. She just had a whole breakdown, and there were no resources in North Carolina. So, being the mom that I am, I got on the internet and I found the best care I could possibly find for her. And so we ended up taking her to a hospital in Chesapeake, Virginia. So my other two have also had issues. My son, he has basically social anxiety. My youngest has social anxiety. Um, my son becomes suicidal one night. I had to get him to the hospital. He texted me and basically told me, bye, mom, that he couldn't do this anymore. So I knew I only had a few minutes to find him, and I did not go to work that day. And as a result, anyway, I ended up losing my job, but I wouldn't have changed it. I found him, saved his life, got him to a hospital, and I say got him the help he needed, but even with hospital care, they can only hold them for 72 hours if they're suicidal. And then he was only in treatment for 2 weeks, which is just enough time to get your medicine in your system and hope that it works. So these are my reasons for being a mental health advocate. So these are the statistics. The reason I chose 2013 is because that's when Sarah had to go to the hospital on her 17th birthday. So right here it's showing 1.3 million youths had a substance use disorder. Over here, it's showing 2.6 million had a mental depressive episode or a major depressive episode. Then last year in 2004, which is the latest data that we have, says 3.8 million adolescents with a mental depressive episode with or without severe impairment. That's 15.4% of all adolescents. So it's showing you right here. This is out of 26 million adolescents aged 12 to 17. And this is the same age on this side. I used the same resource to get both statistics from each year. So as you can see here, there's no improvement. The numbers are getting higher, and we still have the same healthcare system that we had in 2013, which is barely covering any ground. What are the impacts the youth? What impacts the youth in mental health? So our cultural influences are how patients express and manifest symptoms, their style of coping, family and community supports or lack thereof, and their willingness to seek treatment. And I mean, I have to say, as a parent with kids and teenagers, they don't really need an option. They need a parent to step in and say, hey, this is what we need to do. The societal influences is inequality, racism, discrimination, violence, poverty, education, income status, and stigmatism. With that being said, stigmatism is a big one. Kids and teenagers, they're already vulnerable and want to fit in, with their peers, and the stigmatism of being crazy, is not the best look. Commonalities. Mental health illness affects all populations regardless of race or ethnicity. Every disorder is complex in biological, psychological, social, and cultural ways. The deterrence from seeking help is the stigmatism once again, the mistrust of mental health services, bias, stereotyping, misunderstanding, and communication. So why should we care? 1 in 7 10 to 19-year-olds experience a mental disorder. That is 15% of the global burden. Depression, anxiety, and behavioral disorders are the leading causes of illness and disabilities among youth. And this right here really got me. Suicide is the third leading cause of death among 15 to 29-year-olds. People, this is sad. This is not acceptable. It affects not only their adolescent years, but extends into adulthood, limiting opportunities that would lead to a fulfilling life. There are systemic barriers in mental health care. There's no polite way to say it. Our mental health system is not doing its job. These are some quotes I found in articles and news articles. "Don't leave me alone with knives" was the startling plea that echoed through two very different families in North Carolina and exposed the one broken system that is failing children going through mental health crises. David, a 14-year-old in Raleigh, and Ashley, a 10-year-old in Fuquay Varina, each alarmed their parents by asking them to remove sharp objects from their reach. They were afraid. While she waited in a private room, Safira went into the bathroom, locked the door, and swallowed a washcloth. She was throwing up and aspirating, recalled Murphy, who watched as the hospital staff struggled to remove the cloth from her daughter's throat. Far too often, young people experience stigma that invalidates their struggles with mental health. Far too often, young people are treated as if they are incapable of experiencing mental illness. Far too often, young people don't get the help they need. And some of that is not because of them. Some of that is because of the system. I know for my situation, trying to get Sarah help when she was a teenager, there were no facilities that treated 16-year-olds to about 24 years old. So you had a whole high school and college age gap where there was no treatment centers. Later, Brown learned the horrifying truth. It wasn't a supplement. It was sodium nitrate, a hazardous chemical compound Bennett ordered to use for ending his own life. Shortly after using the compound, the next day, Bennett sought medical attention, but it was too late. He died on the way to the hospital. They shipped it in 2 days to him, and it sold for the price of about $13, Brown says. That was the price of my son's life. Call to action. The first thing you can do is research your state or your community, wherever you're trying to make the biggest difference. Determine what programs they have in place for youth with mental health issues and or where the lack of services are. Once you determine those things, you can figure out, okay, what can we do? Volunteer as an advocate in the school system, become a sitter at a mental health facility or a hospital, volunteer at a community center, offer coping skills or group talks at schools, give free art therapy or counseling for homeless youth or poverty stricken. Determine and use your own skills to help. The third thing is, after researching and volunteering, put your data and discoveries together into a presentation. Schedule an appointment with your governor and or mayor to address the issues and your personal discoveries upon volunteering. Know what you're talking about. Present the issues. And fourth, after speaking with the governor and or mayor, ask for suggestions and solutions how you can help make changes in your state and community. Implement the action and hold a public meeting to get supporters and make change happen. You guys, this is the only way that we're going to make changes. You know, I'm not a personal believer of protest. I don't really think it does anything. Standing outside of a building and holding up a sign and screaming does not do it for me. To me, you got to go to the source and you got to make the changes that we need, because our children and our youth are the ones that are going to be leading this country in a few years. We need them to be mentally stable. These are my references. I had 7 different references. I used USA Today with health. I used the NAMI. I used the SAMHSA. And then I also used different articles concerning mental health in adolescents. And of course, I used the national surveys for the 2013 and 2024 results. So basically, you guys, I just want to say, take action. This is the list again. Just do something. Do something. We can all do something. And this is Gina Riggan again, and I thank you for your time.